This is a routine that I do every day. Most women after breast cancer treatment are left with some degree of pain or tension in their neck or shoulders. This 5-minute routine is a short, time-efficient way to help with this. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. The movements covered in this video are called CARs, controlled articular rotations. Controlled meaning we're actively using our muscles to move through the different movements rather than passively stretching. Articular meaning joint, and rotations, this is what we're going to be doing for each of the joints. CARs help to gain and maintain healthy movement of the joints. At the same time, they also help to improve stability in the muscles surrounding those joints. And that's something you're not going to get with stretching alone because you don't have that active component. CARs for our joints are analogous to brushing for our teeth. We don't stop brushing our teeth when they're clean. We continue to brush them to maintain this. Our bodies, including our joints and muscles, need to be maintained too. There are 3 movements in total. We're going to be doing CARs for the neck, the shoulder blade or scapula, and the shoulder joint. These movements are a part of a full body routine that would take longer to do, but for this video, I'm going to be focusing on the areas that pertain to breast cancer treatment. During each of the movements, we're going to be creating full body tension by squeezing all the muscles in our body. For example, to create more tension in the upper body, we would make fists with our hands. For the lower body, you can think of squeezing your legs, glutes, and abdominal muscles. This may look odd, but tension in the surrounding muscles drives more juice to the area that we're trying to target, and this increases our control over that joint. You're going to be taking each specific joint through its full range of motion. This is really important as this is what makes these exercises really effective. As time progresses, you should be able to increase that range of motion. Stay tuned for the last exercise. It's the most complicated, but also the most effective if you have any shoulder tension or pain. You're going to do 3 reps of each exercise in each direction. That's it. Remember, CARs are meant to be done as a daily routine. The benefits of any exercise come from the consistency over time. You'll see once I go through the exercises, but if you're able to do 10 repetitions of each, you're definitely doing it wrong. You likely aren't creating enough tension as you're moving through the rotations. I go through the full routine at the end so you can follow along. The first movement is neck CARs. With full body tension, make a circle with your neck by bringing your chin down to your chest. Rotate chin along the collarbone to the side. Side bend ear to the shoulder. Rotate in a semicircle back around to the other side. Side bend ear to that shoulder. Chin to the outer collarbone, and then chin along the collarbone down towards the center. You can repeat in the other direction, and then that would be 1 full repetition. In terms of the speed, you want to move slowly. Imagine moving through thick air, so you're purposely adding extra resistance to the movement. Try to keep the rest of your body, or at least from the neck down, relatively stationary. Maintaining that full body tension will help with this. Addressing reduced movement in your neck can significantly help shoulder issues, both in terms of pain and tension. The second movement is scapular or shoulder blade CARs. This is actually one of my favorites. You can either make fists with your hands or have your hands glued to your side throughout the movement. Start upright with your head in neutral. With full body tension, make a circle with your shoulder blades by raising your shoulders up to your ears, retracting back or squeezing between your shoulder blades, lowering down all the way, and then moving them forward so your shoulder blades would move further apart. Once you do the backward CARs, you would do the same thing in the opposite direction going forwards. It's really common that people will bend their arms as they're doing this exercise. Do your best to keep your arms straight throughout. There's a tendency to lose tension through your midline, so your back arches or rounds as you're going through these CARs. Try to keep your body rigid so the focus of the exercise remains on the muscles surrounding your shoulder blades. You can vary the position of your arms to target the muscles in a bit of a different way. For example, you can have your arms raised up in front or out to the side at any angle. There's really no right or wrong with the angle that you have your arms at, but the variety in position can be really helpful. I find my shoulder area and neck feel much better when I do this consistently, and it also helps with posture. If you had radiation, you may notice the muscles on that side don't activate as well. This is the case for me when I do these scapular CARs, and I find the motion just doesn't feel as smooth and crisp as I'm going through the rotations. It's gotten better over time, but it's still not equal to the non-radiated side. The last movement is shoulder CARs. Like I said, this is the most complicated movement as there are quite a few steps, but it's really effective as an exercise. We're going to go in the forward direction first. You can make a fist with your non-moving arm, and your working arm starts at your side. With full body tension, move your arm across your body until it reaches an overhead position. Rotate your arm inwards as far as you can, and then move your arm back in a semicircle so your arm finishes by your side. Now you're going to reverse this movement in the other direction. Start with your palm facing back. Raise your arm up maximally, keeping your palm towards the ceiling. Rotate your arm fully outward, then move your arm through a semicircle up and over, and you'll end up with your arm by your side. There's a tendency to rotate your body as you're moving your arm through the semicircle. Try to keep your shoulders and hips pointing forward throughout this movement. Squeezing your abs and glutes can help with this. A variation is to do the shoulder CARs adjacent to a wall. This gives you a clear picture of what your shoulder range of motion is really like, as any imbalances that you have are going to be magnified in this position. You may think your arm is going up pretty high overhead, but then you can see how much you're rotating to accomplish this. You'll probably need to stand a decent distance away from the wall when you're starting out. As your shoulder motion improves week by week, you can stand a little closer to the wall. If you do find that you keep rotating your body each time you do this movement, take another step away from the wall because you're probably still too close. You can start doing CARs about 4 to 6 weeks after your surgery. Check with your healthcare team on when it's right for you to start. CARs are most effective when they're done daily. How can you keep consistent with these over time? What I do is I pair them with my workouts. I do them as the first thing in my warm-up for each workout that I do. As long as I work out regularly, then I'm able to also stay consistent with doing CARs. If your workouts aren't as regular, then try to pair the CARs with another habit that you have daily. You could do them before a walk or as a part of a morning routine or wind down routine at night. Here's the full 5-minute routine. Follow along with me. We'll start with our necks first. Make fists with your hands, or you can have them right by your side. Chin down to the chest, rotate around, ear to the shoulder, semicircle around to the back, ear to the other shoulder, chin to the outer collarbone, into the center. Moving in the other direction, chin to the collarbone, ear to the shoulder, semicircle around to the back, ear to the other shoulder, chin to the outer collarbone, back to the center. Rep 2. Rotate to the side, ear to the shoulder, semicircle around to the back, ear to the other shoulder, to the outer collarbone, back to the center. Chin along the collarbone, ear to the shoulder, semicircle around to the back, ear to the other shoulder, and back down to the center. 3rd rep. Rotate, ear to the shoulder, semicircle around to the back, ear to the other shoulder, chin to the outer collarbone, back to the center. Reverse. Rotate, ear to the shoulder, semicircle around to the back, ear to the other shoulder, chin to the outer collarbone, back to the center. Shoulder blade CARs are next. Start with your arms either at your side or out somewhere in front. Raising your shoulder blades up, retracting back all the way, pushing down all the way, and out in the front. Again, up to the back, retracting, down as far as you can go, and out to the front. Up, retracting back, down, into the front. Now we're going to reverse it. Down, back, up to the front. Down, retracting back, up to the front. Down, retracting back, up and to the front. Shoulder CARs are the last one. Start with your non-moving hand in a fist. Arm comes across your body all the way up. Rotate inwards, semicircle around to the back, palm to the ceiling, lower down. Palm to the ceiling, rotate outwards. Arm goes up and over and across your body. Rep 2. Arm across your body, rotate inwards all the way, semicircle around to the back with your palm up, lower down. Palm up to the ceiling, rotate outwards, arm goes up and over, all the way across your body. Rep 3. Arm across your body, rotate inwards all the way, semicircle around to the back, palm up to the ceiling, lower down. Palm to the ceiling, rotate outwards, arm comes up and over, across your body by your side, using the other arm. Arm across the body, rotate inwards, semicircle around to the back, palm to the ceiling, lower down, palm to the ceiling, rotate outwards fully, arm goes up and over, across your body, to your side. Rep 2. Arm goes across the body, rotate inwards all the way, semicircle around to the back, palm to the ceiling, lower down. Palm to the ceiling, rotate outwards all the way, arm comes up and over, across your body. Rep 3. Arm goes across your body, rotate inwards, semicircle around to the back, palm goes up to the ceiling, lower down. Palm to the ceiling, rotate outwards all the way, arm comes up and over, across your body, and then down by your side. If you enjoyed this video, it'd be great if you subscribe to let me know. Let me know in the comments below how your neck and shoulders feel after doing this CARs routine for a while. Thanks for watching and see you next time.